and her friend Louse Allard, calling in from Uganda. And they've been talking the last few minutes on our radio show about their work in Africa. Do I correctly say with maternal health care?
Yes, you're right. So I was telling the story on how I ended up in Uganda, actually.
Hold on a second. We have to introduce you again, Louise.
Okay.
Louise Allard is with us this morning. She comes originally from Quebec, from Canada. French speaking. She has a background in nursing, human rights, natural family planning, and philanthropy. She's a former administrative nurse. She is using her skills to improve maternal health in Uganda while supporting a life-affirming ethic in all her endeavors. She lives part-time between Southern California and Uganda, where she directs non-profit organizations both in the U.S. and Uganda. She has a pregnancy resource center in Kampala and a bakery, and is working on opening a medical teaching hospital in Chibale, Uganda, where the Catholic Church donated 100 acres of land to set up the St. Raphael Hospital Project. She is the author of a book, Surrender and Discover the Abundant Life, about her work on the mission field, mentored by myself, and I am one of the editors of this book. So welcome back, Louise. You were talking about Africa, and you are sitting right now in Kampala, Uganda. How is that? Is it safe in Kampala, Uganda?
Uganda is a beautiful country. I would compare it to California a little. 40 million people, pretty much the same population as in California, approximately the same size. I would say that the population in Uganda is probably living like in the 1950s compared to us in terms of being more developed in California. But they're wonderful people. They were a colony from England, so they have acquired their independence in early 60s. And so, but they're very much English in terms of their attitude and culture. And the principal language, the main language, is English. And so this is a very dignified people, very welcoming and very just happy people. And they're very welcoming. So I feel safe here. It's not always safe. No, it's not. But you have to be wise. You have to know what to watch for. But if you are careful, you're able to do your work.
Great. So tell us a little bit about the Catholic Church. When we went to Uganda, and the Catholic Church donated 100 acres of land for our project. Tell us a little bit about that.
Okay, how this program came about. So you came with me at 2015 after we announced our interest in starting a teaching hospital in that region. But why that region? Western Uganda, Midwestern Uganda, where the statistics in terms of health were poor compared to the rest of the country. Well, let's qualify that. Uganda in the early 2000s was number 149 in the quality of healthcare out of 191 countries. So you could see that the ranking is very low, actually, in terms of quality of healthcare. What's happened in Kampala is that if you live in the main, if you go to the main capital, Kampala, you can get pretty adequate medical care. There are facilities, doctor specialists, all of that. But if you go elsewhere in Uganda, you do not have the same availability of medical services. And in Chibale, for example, in Western Uganda, There is one doctor for 42,000 people. So in California, just to give you a little difference here, is 1 out of 200 people compared to 42,000. In Kampala, it's probably 1 out of 7,000 people. So you could see the difference. How can you get good medical care when there are no doctors around? And so by the time the patient goes to Kampala for care, they arrive there at the terminal illness, stage 4 of their illness. It has progressed so much that little can be done. And so we wanted to do something. The Catholic Church, welcomed us to Alliance for Life International in cooperation with the Catholic Church in that diocese, Hoima Diocese, and gave us 100 acres of land and just told them to, okay, start the project, start planning. And they assigned a lot of people to help us, project coordinator, etc. So we did this for a few years. And then probably 3 years ago, 2020, the church joined us in a more significant fashion, I would say. They got more involved, they assigned more people. And so we hope to be able to begin construction in 2024 in the first quarter. We're waiting for the result of the environmental impact assessment study, which is in progress. And after that, we want to mobilize the community to be involved in fundraising, as well as providing some support for the construction of the hospital.
And Louise, who is funding all of this?
All right. Well, so far, Alliance for Life International has funded the major studies that were needed. Okay. I would say it's God that is funding this project, because we're a nonprofit organization and we have a program. It's called Become a Founding Member. And out of this program, we've have people that have joined us. And this so far has paid for all the studies that we perform and several trips to the region, which naturally I participate in terms of paying for my own expenses. I do that too. But I would say that so far, all of those studies have been paid by donors of Alliance for Life International.
And how hard is it to get people to donate to this type of project?
Okay, so far, the main funding for building a hospital has not come in terms of millions of dollars, okay? We want to start smaller with the pediatric unit. We want to start with the needs of children, a 41-bed, so it's really more affordable instead of building the whole hospital all at once. So we apply to foundations. It's not easy to convince foundations to give us money. 93% of the foundations want to give their money to the US, to an organization in the US, and the project is in the US. They want to see the work that they're contributing. So foreign projects are not really on the list, except 7%. Those 7%, that 7% of money goes to more developed country in Africa. For example, South Africa, Kenya are considered more developed and they get more of the funding. The intent is for the foundation to kind of, or corporation, to develop like, a business base in that new country. And so Uganda does not fit that criteria at all. So the funding that they get usually is for small projects, improving maternal child health, improving nutrition, small project. So it is difficult to fund a project which involved construction. It is difficult. But like I said earlier, we trust God to bring the right people that will be touched by this project and that will want to participate. So we feel like we have great resources here in Uganda in terms of human resources, in terms of buildings and land, in terms of the involvement of the Hoima Diocese. So we have those riches, but we're lacking, being a developing country, they do not have the money to as an outlay to build a hospital. The Catholic Church does not have those funds. But we are raising, both of us are allowed to raise funds for this organization, for this project. And so we hope that the right foundation will come eventually and become the major donor. Or many small donors, many medium-sized donors.
Yeah. Louise, in the Hoima district, they had founded oil there. And it's, tell us a little bit about that and the reason why you picked that area for a little hospital. And also talk a little bit about how far people have to go for medical care. Can they get good medical care in that area? And if workers here in the United States or on the project with the oil in Hoima, where do they get their medical care? So that's a lot of questions at once there.
Okay, about where to obtain medical care. So in 2006 and 2007, they discovered oil in the region in Hoima by Lake Albert. Okay, apparently Congo, which is on the other side, as part of that oil reserve, as well as Uganda on the other side. They have asked China to extract the oil, which they have done. And right at this moment, they are waiting to give a contract for a refinery. I think the US, China, France, there is another country. There are 4 that are online to get a contract to do the refinery. I hope it's the US. That's right. Anyway, so that's what's happening regarding the oil extraction. They're at the point where, yes, the oil can be extracted and they need refinery. And they're also building a pipeline between Tanzania, which is next door to the south, and Uganda. They're building a pipeline. Why did we pick Hoima? Well, first of all, Western Uganda, like I said, had worse statistics in terms of health. They died younger. They're not diagnosed of their problem where they live. There is no lab work. There is no x-ray, no ultrasound. There is no modern medicine. The medicine is practiced by physician assistants that are wonderful and certainly able to take care of you if you have a common disease like diarrhea, vomiting, pneumonia, that type of thing, malaria. They do a good job. But if you need to be diagnosed, for example, of a heart problem or cancer, or like about 40% of the problems that you need to be diagnosed of, it's not going to happen in that region. So you will not know exactly what's happening with you, and you will suffer the aggravating symptoms. And then eventually you will end up in Kampala to find out what's wrong with you. And usually that's too late. It's too late. There's a lot of money spent in the last months or years of life, but not for a good result because they've waited too long to see treatment. So that's what's happening outside of Kampala. All right.
And who's paying for the medical care there? Is there a national health insurance there? Tell us a little bit about the national insurance and the health care and who pays for all the services and medicine, etc.
Sure, the finances. The government have their own hospitals. There are kind of 4-level clinics, and they have more than 4 levels actually, probably 6 level. Okay. So the government has their own facilities, and they say they pay for care. But when you go, they say, okay, the nursing is free. We'll take care of you. Often the medication is free, but not the supplies. So you need to go to the pharmacy and buy for example, the intravenous bag with the solution from the pharmacy. You need to buy the dressing, the needles, that type of thing. Once you bought these supplies, you go back to the hospital, they will use them, and the nursing will be free. And the physician assistant that is taking care of you. So that's pretty much how it works. So that's the government. Now, there is another system, a parallel system, which is mostly run by the Catholic Church. Did you know that the Catholic Church has been in the business of healthcare since year 300 AD? They started their first hospital in year 300. The first hospital, there were no hospitals before. Patients were taken care of by their families. And so the hospital has a lot of experience, and they have started big hospitals, very small actually, which they have grown over 100 years, especially in the capital of Kampala. Large Catholic hospital, a little bit the same as in Orange County. You know, in Orange County, California, we have 3 large Catholic hospitals, St. Joseph, Mission Hospital, and St. Jude. So it's pretty much in the same regard. The Catholic Church is involved. And we're very pleased that the Catholic Church is involved in this project, because it means that eventually they will own these facilities. They will own and manage, and they're very good at it. They're very economical. They're very organized. People love the care that they render. So even though they have to pay, because this is not the government who is paying now, they keep the rates low, and people prefer to go there. That's the bottom line. Sometimes you go to a government hospital, there's no staff there. There's nobody there. So people wait and wait and wait, and there's so many people going there, hundreds of people, and there's 3 or 4 workers. For sure, they're not going to be seen that day. And so that's why the Catholic system prevails, in a sense, in terms of quality as much as providing the care. As for health insurance, if you're in Kampala, if you're working for a corporation, they will offer, often, big banks, things like this, they will offer health insurance. But 95% of the population does not have access to health insurance, all right? They're not used to that at all. Because 85% of Ugandan are farmers, all right, that's the mainstay of their economy. So these are private businesses, isn't it? They're private land. And so they do not have access to the health insurance. But because of that, and I come from a large HMO system, working for a large HMO system in California, in Orange County. I took that model and I brought it to Uganda. Why? It's because my previous CEO at Kaiser Permanente came to Uganda in 1997 and started the health insurance by Health Partners, which is an HMO. He started, a facility here for health insurance. It has taken in the south of Uganda. When I saw this, I read his thesis. I was so excited. I said, one day I will start that health insurance in the area where we're working with the hospital. So we started this in 2018. And it's like, it works as a cooperative model. And it's very, very reasonable. The cost of health insurance is unbelievable. Like 10,000 Uganda shilling, which is about $3-4 for a family of 4 for 3 months. How could that be? How could you provide medical care for 4 people for 3 months for about $4? So it's very interesting. I believe in that system very much. They are offering the care at the health center, 3 level of care. It does not pay for everything. It does not pay for chronic conditions. It does not pay for surgery, but it will pay for the care of all illnesses like malaria, pneumonia, diarrhea, children illnesses. It will pay, for example, for delivering a baby. So it pays for a lot of things. I think it's a wonderful value. And we hope to be able to increase the level of care, like so that it would pay for surgery, for example. We hope to do that. I want to be instrumental. I'm a big health insurance promoter. So I want to be involved in promoting it in Uganda to continue to do this. Yeah.
Paul, do you have any questions at this time? Anything that you would like to comment on or talk to Louise about?
I think that it's a fascinating story. I guess I have to ask the question I always want to ask, the obvious question: why? And why Uganda? Why do this work? And why Uganda?
Yeah, why Uganda and why Africa? Why get involved in Africa?
Yeah, I hate to say it, I'll preface it by saying we've all heard of the misery of Africa. I grew up watching all the sad tales of starving babies and famine and all this stuff here. It seems to be kind of and I think many Americans, this is going to be a horrible thing to say, you almost get exhausted. It seems insurmountable. It seems like it's one drop in the ocean. And I wonder if people just give up because it seems to be just an insurmountable continuing crisis. So talk to why did you do that, and is any of that real, or is that just me?
Well, I would give a little bit more hope. Okay, I've been coming to Africa for 20 years, to Uganda particularly for 15 years. My work is very welcomed here at the pregnancy level center, pregnancy center level, as well as the hospital level. They assign people. I used to come twice a year, and I would stay only 2.5 weeks, twice a year. So I would come and spend the money from the Alliance to develop the project that we have, and it would always get done in 2 weeks. Sometimes the work would continue, but at least we had gotten the bid and assigned the work and all of this. They know that I'm there for a short amount of time, and so they would all cooperate to get everything done, all the goals. Now I'm spending more time since COVID time. I spent 9 months during the COVID year, and then after that, 6 months. So I'm pretty much here half the time, back and forth. So you were saying why Uganda? Why did you end up there? I think there is a little spiritual answer there. Okay, I experienced a divorce at age 50. I was not expecting it, and I was not welcoming it. It took me about 5 years to recover from that experience, and it was 1999. And then Edna asked me to accompany her to Africa in Congo in 2003. I must say that I had some healing under my belt, and I was excited to go with her. And I think, when you've been married for 30 years, and this happens to you, you feel like you're losing your purpose. You don't see, you need a new identity. And I certainly refused that one of being divorced. It just was awful to me. So, Africa provided a new identity for me. I became a pro-life missionary. That's what I am. I'm a pro-life medical missionary. I didn't give myself that title lightly. Especially I was going only 2-3 weeks, twice a year. But since I've been coming here and staying here much longer, I feel like, yes, this is who I am. I'm a pro-life medical missionary. I'm pursuing big goals. The hospital is a big goal. But I feel like totally surrounded here with wonderful people, educated people. Actually, all the people that are working for me are very educated, even though the jobs don't necessitate it all the time. and they're just wonderful. They're so happy to have a job. I want to lead trips to Uganda. I want to bring people.
So is there a sense of,
wonderful country?
You said there's a sense of more hopefulness there. Talk to us on this end here, because I don't think I'm making this up. I think many people here in the United States, maybe Etna can chime in too. We tend to feel we want to help, but when you look at the third world, particularly Africa, it seems like it just never makes a difference. The more money goes in, maybe it's corruption, maybe the problems are overwhelming, maybe they're just a continuing. It's a cultural thing, it's a society thing, I don't know what it is. But we don't seem to make a difference, with some exceptions. I know that Jimmy Carter pretty much eradicated guinea worm, and I know that was a pretty huge one. He tried to take on one that he thought in his lifetime he could change. He wanted to show that this wasn't a bottomless pit, that this was something that you could, in a lifetime, achieve some results. Are you seeing that same kind of hopefulness? Because I think many of us are still feeling hopeless in the face of these insurmountable problems.
You have to think smaller. Mm-hmm. Although here they're telling me, Louise, you have big goals. That's because you're an American, like the hospital project certainly is a big goal.
And maybe that's the problem. Americans want to do big things. We want big change.
We want to do big things because we see large needs. Right. Okay, we see a lot of needs, so we want to do big things. But not all of our projects are big. Actually, they're on a small scale. And because most of our programs are on a small scale, we see results with that. Okay, we have to adjust our thinking. Are we looking at a 1 million beneficiary as being our goal? No, it's not my goal. It's not my goal at all. So we're thinking smaller, but we're making a difference where we are. We have different programs to address different needs. We have several programs actually. I'll just give you an example yesterday.
Okay.
We moved here in the suburb of Kampala 2 years ago to open the bakery and the vocational center and the pregnancy resource center. The pregnant women are not coming to us. I was so frustrated because I know about 25 to 40%. Statistics here don't really exist too much, but about 25 to 40% of children are born out of wedlock. Okay. So we do know that having a child without being married is very common. So we're wondering why we're not getting the pregnant woman here. But anyway, we're a little bit isolated, okay? We are not in the main center of town. Right. We're in the back. We're with the cows, actually. We're beautiful.
You're where the cows are? Oh, my goodness, here. That's way out in the back.
We love the cow. Now, listen to this. We have big homes here. University professors, business people, doctors, they're building their homes here. So they're in our neighborhood. But we also have cows, which is just and I have a beautiful view. So it's very interesting. I love it here. Country, like I said, it's country. So maybe we are more difficult to find.
Right.
But anyway, even after 2 years and publicizing this, I don't have them. So, I just feel like when I came back this time, I said, you know what? I'm done trying to find a pregnant woman in crisis pregnancy. I'm done. I'm going to offer care or a program for single mothers with young children, because I know they are aplenty. And so I said, you know what? That's what I'm going to do. So yesterday, we had our first meeting in a church, and it's a joint program with that pastor and us. And so our manager presented, the pastor presented, and so we had a time of sharing also, because it's like a support group for pregnant women.
Right.
So there is 1 hour of teaching, giving them new knowledge, and then 1 hour of sharing their experiences as a mother, and about half an hour praying, and then also, refreshment and that type of thing. the church is about 50 to 60 people. Well, I don't know how many, but that's what it contains.
Right.
Okay. 50 to 60. Well, it was full. It was full. They were even on the outside.
So maybe it's just the programs that you're offering and the way you're offering.
Yes, and it was the first time.
Let me ask you one more question here.
Yes.
I know you're passionate and you can go on forever about this here, and there's a lot to hear.
Probably. Yeah.
We had somebody else on. I don't know if Etna knows Nick Jordan, who does water wells in Africa and also in Uganda for some reason. I don't know why everybody's focusing on Uganda here.
They're wonderful people. They're so welcoming.
So
I'll chime in there, Paul. I worked with Nick in Uganda with Wells of Life.
There you go.
Many years ago. So Nick is from Ireland also.
Exactly.
So.
The parallels are uncanny. Two Irishmen that from Southern California who decide to go out and minister to people in Africa, and you both picked the same country, Uganda. So it's strange how they think. But what I was going to say is this, Nick said this, is that he went over to drill wells. Pretty simple proposition. Water's under the ground. Right. They need it. Yep. They walk miles to get it. And so doing, the girls spend all day. They're beasts of burden. They can't go to school. They can't do anything. They're just collecting water for the family.
Right.
And then he realized a couple of years into this, I got to do more than drill wells. I got to teach them about clean water. Because what good is it to have a well if the cow is eating and defecating and everything in the well, and we're just contaminating this clear water? Or if they're not washing their hands, they're still got clear water to begin with, but they're fouling it with all the things they're doing. So it became, he said, the problem was, to him as an American, was so simple. Get some money, drill a well, done. Then he realized it was a cultural change. He had to look at it from a bigger perspective. Is that same thing hold true for maternal care? Is it, you would think, well, I'm going to give you the advice, I'm going to give you the resources, and poof, something's going to change. Maybe it doesn't change, though, because there's something deeper at play here. There's a bigger issue in the society or a cultural that has to change. Yeah.
Definitely. At the moment, we're addressing the problem, for example, of pregnancy outside of marriage from teenagers as well as young women. It just happens this way. They're careless about that. They are. And then it's almost 98% of the time the young man will not feel that he is able to support the woman.
Right.
And so therefore he will be absent. Right. So it's not like in California or the US where the man is expected to parent this child, even though he might not live with the mother. Right. He's expected to be involved in some degree. Right. Not here. The law does not force him to do that. So for us, we have a program for teenagers. It's called, it's a youth abstinence education program. We encourage the youth to abstain because even though they might use contraception, for example, teenagers are not good users of everything. Right. And so therefore they would get pregnant anyway. They would get pregnant anyway over time. We do not favor that type of program. So we use a youth abstinence education program.
Well,
we're trying to address the problem from different angles.
And is there a cultural hesitation for women to come forward and seek help, or do they welcome? I don't know the position of women in Africa, but the assumption is that they don't have equal rights and they're controlled by the men and the families and whatnot. It's still a traditional kind of, just shut up and be quiet and persevere type of thing. Don't stand up for yourself. Don't advocate for yourself. Don't seek help for yourself.
But in this case, they're single mothers. Right. So they really have been abandoned, often by the family. Not always. It seems we encourage the family to come back, to come back in the picture. But certainly from the man. So she doesn't have that, so she comes. No. She's very needy. She's very needy.
Right.
Yeah.
Well, I applaud. We're down to our last couple minutes here. What would you? We have to end a couple minutes earlier. I have another show right after this I have to get ready for. What would you say to people like me? I'm a good Irish Catholic here, where our hearts are there. We feel called to help, but we feel hopeless. It's so far away, and it seems so impossible to change. And are we wasting our time and effort? Would it be better spent elsewhere? What limited time or resources we have? What would you say to people? You obviously have a hopeful and a commitment to this country and to this part of the world here. Give us a little hope and inspiration. It's not all is not lost.
Well, for example, I would like to encourage people that might even consider, such, there is an interest, let's say, to go to the websites. We have two websites. One and it's exactly www.allianceforlifeinternational.org.
All right.
Okay. The other website is Saint Raphael Hospitalproject.org.
Okay. And is it all spelled out just ST or SAN?
Yes, it's ST. Saint Raphael is RAPHAEL.
Okay. And why
Hospital Project?
Why Saint Raphael? I don't know the story of Saint Raphael. I know some
he
of the
was
things.
An archangel. He's an archangel with Michael.
Okay.
Yeah. All right. So anyway, so definitely I would, and then look under publication or newsletter or writing. And then you will see the report from Uganda or the publication. It's called Life Watch. We're a human rights organization, so we're still having this educational bent.
Right.
Life Watch and report from Uganda. And you know what? You will be encouraged by the reports and the progress that we are making.
Good.
Hopefully, you will be inspired and encouraged.
And if you are so encouraged, what do you encourage people to do? Is it just simply donate? Is there a monthly donation program?
Well,
do you take trips to Africa and show people? That was what Nick always said. He said, I can tell people in California all day long about the need, and I can beg and cajole and berate some of them into giving some money. But he said, when I take them there, everything changes. Their commitment changes. They see it. They understand it. It comes to life. Do you ever bring people to Africa to see what you're doing?
I have like a dozen people over time. I've been coming to Uganda 15 years. So yes, a dozen. But I'm doing more than this now. And you will see it on allianceforlifeinternational.org website under ways to help. Okay? Volunteer with us. So this year, I'm trying to give a personalized trip to the people that come with me. What do I mean by that? I want people to discover they have skills, they have, passions or whatever.
Right.
I want to match their skill with the people here. I want them to have experience with working in their field.
Yeah.
For a few days, mixed with tourism, safari, fun things together, but have separate experiences. So I have designed this trip, and the first trip of that nature will be in August, end of July 2024. So this is on the website, and I want at least 7 people to come with me.
There you go.
And this is just very well planned with travel agent, etc., etc. Very well planned. So it's going to be fun. So that's for people that would consider coming. Otherwise, just get the newsletter, get the report from Uganda. And I think that you will be encouraged and you will want to participate. We have a couple of fundraisers every year in Orange County.
Okay. Well, I hope you'll come back when you do one of those. Yeah.
Paul, I would also recommend them reading the book Surrender and Discover the Abundant Life, written by Louse Allard, and it's available on Amazon. And it talks about the stories, about all the times that we have been in Africa, and Louse has been in Africa, and the different projects that we did while we were there. And it encourages people. Now, I know that people don't have to go across the sea to see the cross, and not everybody
Yeah, there's that. Say that again. You don't have to go across the sea to see the cross. There you go.
Mm. Some support the work of the missionary.
Right.
You're right. Some support the work of the missionary, and some want to go also, but it's not the majority of people that go. But the others, they really begin. I mean, I have the same supporters than when we started, let's say, this project in 2008. These supporters stayed with me since 2008. It is because they see progress in the work.
Right.
They're very involved in it. Yeah.
Well, that's the hope we're looking for. Maybe it's because it's far away. Maybe it's because it's in a foreign land. Maybe it's because we've seen so many, we hear so many appeals, so much need there that we get overloaded or overwhelmed, and we just feel we can't do it. But I always remember the story. I don't know who told me this, but it's a famous story. Everybody's heard this story. I'll say it again. I'll end with this. You know, little boy's walking down the beach with his parents at some resort somewhere in some third world country, and all these starfish are washed up onto the beach, and they're all wiggling and dying. And little boy starts picking them up one at a time and throwing them back into the water. And somebody locally says, "Why are you doing this, kid? This happens all the time. You can't save them all." And the little boy says, "But I can save this one." And he throws it into the ocean. Maybe it's just
I can save this one. Yes.
And you don't have to go to Uganda to help out with this project. You can do it from your own seat here in wherever you are around the world.
You can save one.
Out.
Yeah. You can save one. Well, thank you for saving many, and thank you for coming in and sharing your story. I think give us one more time the website, and then we'll end there.
All right. AllianceForLifeInternational.org.
Or the other one if they want to donate, or the hospital.
There, you could, if you are there, you could get the St. Raphael link at the same time.
Got it.
Just remember, AllianceForLifeInternational.org.
All right. That's where we'll send everybody today. Thank you for coming on. I'm always inspired by people like you. You hit a bump in the road and you take a different direction, and all of a sudden your life has a whole newfound passion and purpose. You know, many of us think when you get past 50, particularly divorces and other sorts of things, or you get laid off from your job, that's it. I'm done. It's all over with.
Yeah.
And you're just sitting home watching TV, you know, riding out the last wave here. You've proven otherwise, that you can make a big difference at any point in your life here.
God bless.
In most unexpected ways. Thank you, Edna, for joining us.
Thank you, Paul, for having us.
Thank you, Paul. Thank you. Thank you, Edna.
Okay.
Thank you. Thank you for our listeners. God bless.
We'll see you next time.
Thank you.
Well, there you have it. One more reason to tune in each and every time to Health Talks here with Dr. Trin and the most amazing community of people who are making a difference. One starfish, one conversation at a time here. Right here in Orange County's only community radio station, OC Talk Radio. Streaming live from our studios here at the University of California, Irvine's Beale Applied Innovation Center.